There are a number of things that people can do to improve the appearance of their eyes, and they often want to do so because the eyes are the focal point of the face. When you're younger, you can use Botox to control some of the soft lines around the corner of the eyes or crow's feet and just give your eyes a more rejuvenated look. And once you get to 45 or 50 years of age, often there's extra tissue redundancy in those areas, the upper lids or the lower lids with extra fat pad sort of swelling that does need to be addressed. And the only way to do that and to cause a permanent correction is to do a blepharoplasty or eyelid lift. A blepharoplasty is a cosmetic surgical procedure performed to remove some of the tissues or redundancy in the eyelids and make them look more youthful. It's probably the most common plastic surgical procedure performed, and it's certainly the most well tolerated. The procedure is performed under local anesthetic, sometimes with some oral sedation drugs to relax the patient. And in essence, it's performed either as an additive or a reductive blepharoplasty. In other words, you're either adding extra tissue back, like small amounts of microfat cells to improve the contour of the eye, or removing redundant or excess tissues like extra skin and muscle to improve the shape. In some cases, I'm actually using an anchoring procedure called a canthopexy to lift and angle the corner of the eye to give it a more elongated and youthful look. But because every patient is different, the unique procedure for each patient is tailored directly to them to give them the most youthful look possible. Now, most patients also ask about how long the procedure lasts. And in most patients, they'll get a good correction for about 10 to 15 years. And the advantage of that is that certainly 10 to 15 years from the time that we do the procedure, they're going to look that much younger. And often the procedure and the effects of the procedure can last even beyond that point. But typically, at that stage, a patient might consider a revision procedure if their face is continuing to age significantly. There's no ideal time to have a blepharoplasty procedure done. If you have the procedure done in your 40s, if you've got excess eyelid skin at that stage of life, you can certainly sometimes see added longevity to the correction, but at the age of 60 to 65, you'll often see in most patients excess skin in the eyelids, and certainly at that stage you'll not only get the cosmetic benefit and of the reshaping of the eye, but you'll also see the functional benefit of removing some of that skin that may be obstructing some of your field of view. The procedure and the recovery usually take about 3 weeks to get rid of all of the bruising in the area, but certainly people recover faster if they're very adherent to the post-operative care instructions. One of the questions I often get asked is how visible are the scars once the surgery is done, because people are worried about concealing this surgery. And because the eyelid skin is actually the thinnest skin in the body, it produces some of the best scars that we can actually attain. It just takes time to allow the scars to fade. And finally, the question that I probably get most frequently now is, are there any changes that have happened in the blepharoplasty procedure, any new innovations in the last number of years? And probably the most common innovation that we see now is the use of microfat grafting around the eye. And that's a procedure I've been doing for some time. And what it does is add in very micronized fat cells in around the eye to add volume. And it's the kind of volume that you see in a teenager or someone in their early 20s that's typically lost with the loss of fat around the eye with facial aging. And it can provide an exceedingly youthful look. But again, it has to be tailored for the right patient and for the right look. But yeah, that's probably the most common thing I hear now.